Hey guys, Dr. Ray Marque here, your local chiropractor, Back Pain Relief Center. This is our latest edition of Dr. Ray TV. Today's Monday, I believe it's 11th, not sure, 11th or 12th. But anyway, it's about 3 o'clock. So today, it's kind of unique. I just had a Facebook friend message me and to get some information on what to do when his back goes out, and he told me that every time he goes to lift something up, his back locks up, and it hurts so much that he can't breathe. So let's go over some tips and what to do and how to get to feel better and where you should take this. Number one, if your back hurts that much where you have trouble breathing and it, quote, locks up, meaning maybe you can't stand up or you can't move, without seeing you, this has all the signs and symptoms of a disc problem or a nerve problem, because a simple sprain and strain of your low back wouldn't cause you that much pain. And to be honest, I very rarely see sprains and strains of low back. It's usually a segmental dysfunction, meaning one of the low back joints stopped working. It's putting pressure on the disc, which in turn puts pressure on the nerve. Now, when the pain gets so bad that it stops you from breathing, or you're in so much pain that you have trouble breathing and it locks up, it's almost always the disc pushing on a nerve. Okay, your body doesn't like anything to be near the central nervous system, and the nerves coming out of our back are in central nervous system, so it will surely let you know when there's a problem. Now, can I tell you 100% that you have a nerve problem or disc problem? Absolutely not. For 100%, I would need to do an exam. I would need to do some imaging, and that would tell me exactly what's going on. But you know what? I've been doing this about 18 years, and when people describe this to me, it almost always is what it is. So first things first, if you can't move and it's that severe, I want you to get to either the emergency room, urgent care, your primary, or even better, come in and see me, and let's figure out what the problem is. But if you can't, and you say you're at work or you're home or just can't get to the doctors or to the ER, what I'd like you to do is concentrate on controlling the situation, getting pain levels down, getting inflammation down, and here's how we can do that. Number one, if it hurts, as simple as this sounds, stop doing what's ever hurting it. So if it's bending over and picking something up and it hurts every single time, don't bend over and pick something up until we get you cleared up. If you're at work, let your boss know, let your manager know, say, hey, this is bothering me quite a bit, I can't do this particular move, and I need to stop it. Because you know what, if it's just locking up and you have a little bit of trouble breathing because of pain for a minute or two, one of these times you're going to bend over, it's going to lock up, and it's not going to unlock, and you're going to be stuck. I've seen many patients where they do something as simple as tying their shoes, and then they can't get up anymore, and it locks up. Me being one of those patients, I locked my back up, or I threw it out, whatever you want to call it, because I had a bad disc problem years ago, and I was bent, stuck over for a day or two before we could get it unlocked. So these are the things that I want you to do. First and foremost, stop doing whatever you're doing that's hurting it. Number two, we got to get some ice on it right away. I want you to ice your back 15 minutes on, take about an hour off as many times as you can. I want you to rest it for a little bit. So if your job or whatever you were doing to lock it up is aggravating it, we're going to need a day or two off. And I'm just going to want you to ice it 15 minutes on each hour as many times as you can. Absolutely no heat. And I get this question a lot, and there are times for heat, but anytime it's an acute pain or it's just starting to hurt you right now, you got to ice it for me, okay? Ice 15 minutes on, take a break, and do it again as many times as you can. You want to support it, so you want to get something that's going to support your pelvis and your low back. This way you don't further aggravate it. And you do that by getting a back brace. If you're around my office, stop in. We got some really good ones. If not, go down to CVS or go to Walmart or whatever drugstore and get a back brace and put it on your back. This way you stabilize your lumbar spine and your pelvis to further aggravate it. What happens with belts stabilize the pelvis, they stabilize the lumbar spine, they decompress the joint. They make it so all of your body weight isn't pushing down on those discs. And if you're in that much pain where it's stopping from breathing, it's almost always a disc problem. So any kind of support there will help. So number one, you're going to ice it. Number two, you're going to get a back brace to put it on. Leave it on. Okay, if you're up and moving around, keep it on. If you're sitting down watching TV or sleeping, I don't believe you need it. But if you're up and moving around, leave it on until you begin to feel better. It's going to allow your body to heal. The next thing you can do to help block pain is go get a TENS unit. And TENS units are the little electrical units that you use at therapy, and they stick to your back and they deliver electric current going through there. Again, if you're close to my office, we can get you one. We can even mail you one. If not, you can go down to CVS, Rite Aid, Walmart. Most of the drugstores now are carrying over-the-counter TENS units. You're going to put it right on the area of pain. Okay, so number one, you're going to ice it 15 minutes each hour. Number two, you're going to get a back brace. You're going to support it. This way we further injure it. We're going to decompress it. Number three, we're going to get a TENS unit, okay? Whether you get it over the counter or you get it from our office, put it on there. With a TENS unit, I would do 20, 30 minutes a few times a day. It's going to help block the pain signals. I would get an over-the-counter topical analgesic like BioFreeze, and it's a product we use in our office. Again, we have all this stuff in our office, but I think BioFreeze you can even buy at the store now. You want to put a topical painkiller on, that's going to help. If you're able to, so I'm giving this information not knowing your medical history, if you're able to take an over-the-counter medication such as Advil or Aleve, I would take some just how it's recommended. Consult with the pharmacist first to make sure that it's safe for you, but many patients get some relief. And you need to take it how it's directed and take it for an ongoing time until this pain goes away. The earlier you catch this stuff, the better. If it's getting to the point where it's locking up, you got to get in to see me. If you're not near me, get in to see another chiropractor. Chiropractors and spinal manipulations are the #1 way to relieve the pressure on that joint to get the pain to subside. It's the first course of care I would go to with my back if it were thrown out that much. Again, the earlier you get this, the better the problem's gonna, or the faster this will be resolved. Okay, so let's go over this again. So, number one, stop doing what you're doing. If that's involved with work, we're gonna need a couple days off. Number two, you're gonna ice it for me. You're gonna ice it 15 minutes every hour, as many times as you can. The more ice, the better. Absolutely no heat, okay? You're gonna rest it a little bit, meaning if it's work involved, stop going to work for a day or two. You're going to get a back support, a back brace, whether it's over the counter or from our office. A back brace will absolutely help. It's going to relieve the pressure on there. It's going to keep you stabilized. Ice, rest, back brace, TENS unit, okay? Over the counter TENS unit, okay? You can get them at CVS or at our office, 20 or 30 minutes, 2 or 3 times a day. That will help. Topical analgesic like BioFreeze, okay? That's going to help relieve pain, get inflammation down, get you to feel better. If you're able to, an over-the-counter medication, again, consult with your primary or your pharmacist. Something like Aleve or Advil tends to help. And again, the earlier the better. All that being said, that's how I would recommend getting you to feel better when you're at home. Okay, it's always best to get in to see us so we can tell exactly what's going on, start a corrective course of care to get you out of pain and back to work as quickly as possible. If there's not a chiropractor near you, or maybe you just don't want to go to see a chiropractor, that's all good. Get in to see your primary, okay? So your primary would give you some medication most likely, probably some anti-inflammatories and some muscle relaxers to get you to feel better. If you can't get to your primary, go to urgent care, okay? So a lot of urgent cares around, they're going to do the same thing. If none of those are in there, then try an orthopedic, okay? Orthopedics do a great job at diagnosing the problem and getting you on that road to functioning and feeling better. When it comes to low back pain, though, I think chiropractic's #1 in my book to get you to feel better as quickly as possible. All right, I hope that helps. If we were chatting on Facebook, shoot me a couple more messages. We can talk about it some more. You're even welcome to call the office. I'm at my Murrells Inlet office today. It's 843-804-8100. I'll walk you through it with any questions. All right, I hope that helps someone out there. If anyone else is watching and they would like some more advice on things to do when it comes to their neck or back pain, shoot me a Facebook message. I'll put it on our next episode and we'll get you functioning and feeling better. Have a great day and I'll talk to you soon. Bye-bye.